So transparency has improved over the past few years, but it's still not really part of the research DNA. So the Make It Public strategy signals a move to make transparency the norm. It's about creating better support and encouragement for researchers to be open and transparent in their practice. But it's also about creating better visibility of information about individual research projects for the benefit of the public and patients.
Research transparency is important for a whole series of reasons. The first one is that it's just a matter of decency and politeness. If patients, or in my case parents, allow their children to be involved in research, it's only right that they should know what the results of that research is. And if someone has a disease and they involve themselves in a research project, they're probably as interested as anybody in the results.
I've been a participant in research quite a few times. I've put myself out to go in this trial and you can't even send me what the results are. I think that's a bit rude. And then when I got to think about it further, I thought, well, I should know.
An increase in transparency for drug patients would give them confidence in taking part in further research projects, because the hard work they've put in has provided some benefit to future generations.
I want to use research. Research is practical to me, and I can't use research if I don't know what the results are, if no one tells me.
Make It Public isn't just for the HRA, it's a strategy for the whole research community.
Key to the success of Make It Public will be making transparency the norm and achieving that in a streamlined and proportionate way, maximising opportunities for reuse of information through automated and digital solutions. And we really look forward to working with the HRA on implementing its strategy.
It's a strategy which has been put together by people who know the problem and care about it. So scientists, patients have all been involved in this. It's been put together with a view to what's right and what's sensible and what's possible. It's a practical strategy which can be implemented and which can be made to work.
Our dreams actually direct at trying to encourage researchers to put it into practice, that when they're writing their research proposals and when they're actually carrying out the research, that they will produce their results and that will be provided as feedback to the patients. Having that embedded in the way that they carry out the research is quite important.
We've already started work to make the strategy a reality. That work will involve making changes to the way that we review and monitor research, both within the HRA and in our equivalent bodies in Wales, Northern Ireland and Scotland.
The whole point of the strategy is to make it easy to do transparency, to make it normal, to make it something that is not a problem. Scientists I know would all be very happy to be very transparent. They're not always quite sure how to do it, and sometimes the ways that they're supposed to do it is quite cumbersome. The strategy should make that easier.
Publishing full and unbiased findings from NIHR-funded research is a key principle in our commitment to transparency. NIHR has had a long-standing commitment to transparency, and we're delighted to have been part of and to support the launch of the Health Research Authority's Make It Public strategy.
I think it's a really good time to actually release this strategy. I think what's happened with COVID-19 is there's been an explosion in research, and there's been an explosion in research awareness.
The COVID-19 pandemic has really shone a light on the importance of transparency. We need to know what research is going on so that we avoid duplications. We need to get access to the results of those research projects as quickly as possible so that we can change clinical practice and improve the care that we offer to patients with coronavirus. And really importantly, we need to honour the contribution of the research participants by letting them know what that research study has found.
Never has transparency been more important than with the widespread and rapid research in response to COVID-19 being undertaken globally.
We're involved in research because it matters. So the fact that the HRA, that this matters to the HRA, it is absolutely fantastic.
Thank you very much to everyone who's been involved in developing this strategy so far, and thank you in advance for helping us to make lasting change that will benefit us all.